welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Doctors shortage in government-run hospitals. Delhi High Court issues notice on plea for filling vacancies as soon as possible. The Delhi High Court today issued notice on a bill seeking immediate appointment of adequate number of doctors, including paramedical staffs in government-run hospitals like AIIMS, Safdarjung Hospital, Ram Manohar Lohia Hospital, etc. The plea also seeks to fill up vacancies in hospitals of local bodies like all MCDs and other bodies, including Mohalla clinics being run by the government of NCT of Delhi on urgent basis. The division bench of Chief Justice D.N. Patel and Justice Jyoti Singh asked the Delhi government and the Ministry of Health and Family Welfare to take steps for kick-starting the recruitment process as soon as possible. NEET and NEET PG AIQ Counselling, NMC issues direction for government medical colleges. With the commencement of admission season, the National Medical Commission has directed all the government medical colleges across the country to mandatorily keep 15% MBBS seats and 50% PG Medical MDMS seats in all India quota AIQ counselling. The Medical Counselling Committee conducts the NEET PG counselling process for admission to 50% AIQ seats and 15% for NEET AIQ counselling for MBBS seats. Pay equal stipend to RGUHS Private Medical College MBBS interns, National Students Union writes to Education Minister. Pointing out the huge disparity in pay to the MBBS interns at the government medical colleges and those studying at the private ones, the National Students Union of India recently approached the Karnataka government seeking its intervention regarding the matter. In a letter addressed to Dr. K. Sudhakar, the Minister of Medical Education of Karnataka, NSUI pointed out how doctors and healthcare workers have served the nation while putting their own lives at risk. While these warriors are leading the battle from the front, the least I can do is ensure that they get basic remuneration that they deserve, added the letter. NMC frames regulations to prevent and prohibit ragging in medical institutes. With an aim to curb the menace of the ragging at the medical college across the country, the National Medical Commission has recently framed Prevention and Prohibition of Ragging in Medical Colleges and Institutions Regulations 2021. The regulations have specified the definition of ragging and also the actions that may constitute ragging. The NMC, the apex medical education regulatory body, mentioned the measures to prohibit and prevent ragging by institutions, including the duties and responsibilities of the institutes. CDSCO panel allows Novartis to waiver conditions for study of anti-malarial drug Cipargamin. Based on the justification provided by the pharma major Novartis, the subject expert committee of the Central Drug Standard Control Organization has approved the waiver of two conditions recommended earlier by the committee regarding the phase 2 study on experimental synthetic anti-malarial drug Cipargamin. That's all for today. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.